Benefits of lung health. Improved respiratory function. Healthy lungs function efficiently, allowing you to breathe in an adequate amount of oxygen and exhale carbon dioxide. This is essential for overall well-being and energy levels. Enhanced cardiovascular health. Efficient lung function supports the cardiovascular system by ensuring that oxygen-rich blood is pumped to the rest of the body. This can contribute to a healthier heart and reduced risk of cardiovascular diseases. Increased stamina and endurance. Good lung health enables you to engage in physical activities with less effort, leading to increased stamina and endurance. This is crucial for activities such as exercise, sports, and daily tasks. Optimal oxygen supply. Healthy lungs help transport oxygen from the air to your bloodstream, ensuring that all cells and tissues in your body receive the oxygen they need to function properly. Improved immune system. Function. The respiratory system, including the lungs, plays a role in filtering out harmful substances and pathogens from the air. Healthy lungs contribute to a robust immune system, helping protect the body from infections. Better respiratory. Muscle strength. Regular exercise and activities that promote lung health can also strengthen the respiratory muscles, making breathing more efficient. Reduced risk of respiratory conditions. Maintaining lung health may help reduce the risk of respiratory conditions such as asthma, chronic obstructive pulmonary disease, COPD, and other lung diseases. Enhanced quality of life. Good lung health supports an active and healthy lifestyle, allowing you to participate in a wide range of activities without experiencing shortness of breath or fatigue. Ways to support lung health. Regular exercise. Engage in aerobic exercises that promote cardiovascular health and respiratory function. Avoid smoking. Smoking is a major risk factor for lung diseases. Quitting or avoiding smoking is crucial for maintaining lung health. Air quality. Be mindful of the air quality in your environment. Avoid exposure to pollutants and consider using air purifiers if needed. Proper nutrition. A healthy diet rich in antioxidants, vitamins, and minerals supports overall health, including lung health. Breathing exercises. Practice deep breathing exercises and techniques to improve lung capacity and function. Regular checkups. Schedule regular checkups with your healthcare provider to monitor and maintain lung health. Taking proactive steps to support lung health contributes to overall well-being and helps prevent respiratory issues. If you have concerns about your lung health, it's advisable to consult with a healthcare professional for personalized advice and guidance. Lunges are excellent exercises for working the muscles in your legs and glutes, as well as improving balance and flexibility. Here's a simple guide for beginners to perform a basic forward lunge. 1. Forward lunges. Step forward with one foot, lower your body, and then push off to return to the starting position. 2. Reverse lunges. Step backward with one foot, lower your body, and then return to the starting position. 3. Walking lunges. Take a step forward with one foot, lower your body, then bring the back foot forward to meet the front foot. 4. Side lunges. Step to the side with one foot, bending the knee while keeping the other leg straight, then return to the starting position. 5. Curtsy. Lunges. Step one foot behind the other and to the side, bending both knees in a curtsy motion. 6. Diagonal lunges. Step forward and to the side at a diagonal angle, lowering your body into a lunge. 7. Lateral lunges. Step to the side with one foot, keeping the other leg straight, and lower your body into a lateral lunge. 8. Pulse lunges. Perform a regular lunge, but instead of returning to the starting position, pulse up and down before returning. 9. Clock lunges. Imagine you're standing in the center of a clock. Lunge forward to 12 o'clock, then 1 o'clock, 2 o'clock, and so on. 10. Tap back lunges. Step back with one foot, lightly tapping the toes on the ground, and return to the starting position. 11. Knee lift lunges. After completing a lunge, bring your back knee up towards your chest, before stepping back. 12. Kickback lunges. Perform a reverse lunge, then kick the back leg straight behind you before returning to the starting position. 13. Crossover lunges. Step one foot across the front of the other in a crossover motion, lowering into a lunge. 14. Side-to-side lunges. Step to the side with one foot, lowering into a lunge, then return to the center and repeat on the other side. 15. Twisting lunges. Perform a forward lunge and twist your torso toward the side of the front leg. 16. Jumping lunges. Jump and switch legs in midair, landing in a lunge position. 17. Alternating lateral lunges. Step to the side with one foot, then the other, alternating between legs. 18. Front kick lunges. After completing a forward lunge, lift the front knee and kick straight ahead before returning. 19. Low lunges. Perform a regular lunge, but keep the back knee close to the ground throughout the movement. 20. Elevated lunges. Place your front foot on a small elevated surface, like a step, and perform a lunge for added challenge. Remember to maintain proper form, engage your core, and start with a comfortable number of repetitions. As always, listen to your body, and if you have any concerns or health conditions, consult with a fitness professional or healthcare provider before starting a new exercise routine. Lungs diseases. It seems like there may be a small typo in your question. If you're inquiring about lung diseases, I can provide information on various lung conditions. Keep in mind that this information is not a substitute for professional medical advice, diagnosis, or treatment. If you have concerns about your health or are experiencing symptoms related to lung diseases, it's important to consult with a healthcare professional for proper evaluation and guidance. Here are some common lung diseases. 1. Asthma. Asthma is a chronic condition that affects the airways, leading to inflammation and narrowing of the bronchial tubules. This can cause symptoms like wheezing, shortness of breath, chest tightness, and cucking. 2. Chronic obstructive pulmonary disease, COPD. COPD is a group of progressive lung diseases, including chronic bronchitis and emphysema. It is characterized by airflow obstruction, leading to difficulty breathing. Smoking is a significant risk factor for COPD. 3. Lung cancer. Lung cancer occurs when abnormal cells in the lungs grow uncontrollably. It is a leading cause of cancer-related deaths worldwide. Smoking is a major risk factor, but non-smokers can also develop lung cancer. 4. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. It can be caused by bacteria, viruses, or fungi. Symptoms include cough, fever, and difficulty breathing. 5. Interstitial lung disease, ILD. ILD refers to a group of disorders that cause inflammation and scarring of the lung tissue. This can result in difficulty breathing and reduced lung function. 6. Pulmonary fibrosis. Pulmonary fibrosis is a type of interstitial lung disease characterized by the progressive scarring of lung tissue. It can cause shortness of breath and a persistent cough. 7. Bronchitis. Bronchitis is the inflammation of the bronchial tubes. Acute bronchitis is often caused by viral infections, while chronic bronchitis is associated with long-term irritation, often due to smoking. 8. Cystic fibrosis. Cystic fibrosis is a genetic disorder that affects the lungs and digestive system. It leads to the production of thick, sticky mucus that can clog airways and cause respiratory infections. 9. Pulmonary hypertension. Pulmonary hypertension is a type of high blood pressure that affects the arteries in the lungs and the right side of the heart. It can lead to shortness of breath and fatigue. 10. Tuberculosis, TB. Tuberculosis is a bacterial infection that primarily affects the lungs. It can cause symptoms such as cough, weight loss, and night sweats. If you suspect you have a lung disease or are experiencing symptoms related to your respiratory